Government benefits, often referred to as government transfers, can be categorized into four groups: unemployment benefits, Medicaid, SNAP and TANF, and grants. Unemployment benefits are cash payments made to individuals who lost their job due to no fault of their own. The amount and duration of unemployment benefits depends on how much the employee was earning immediately prior to losing their job. Benefits typically last for 26 weeks or less, and the maximum unemployment benefits are capped. Medicaid is a health insurance program for low-income households. So if Frank is unemployed for a long period of time, he will quickly realize that his employer helped cover other regular expenses that he must now pay for directly. These fringe benefits represent assistance provided to employees as part of their overall compensation package. Although employees rarely see fringe benefits as income, employers certainly view these benefits as part of every employee's compensation package. For example, someone who earns $50,000 per year may receive $25,000 or more in fringe benefits. The bulk of these costs come from health insurance benefits, contributions to retirement plans, and vacation pay. When he loses his job, Frank will also lose his fringe benefits. This means that Frank will need to replace not only his lost wages, but also the fringe benefits he and his family have come to rely on, such as health care for his pregnant partner. As a temporary measure, Frank can apply for Medicaid or a state-run equivalent program funded in partnership with the federal Medicaid program. Medicaid is a health insurance program for low-income households. Each state has different qualification rules, so Frank will need to check with his local health department or child and family services department to find out if he or his partner qualify for coverage. Now, Frank and his partner may also qualify for Medicare, which is a federally run health insurance program for elderly individuals when he reaches age 65. The Supplemental Nutrition Assistance Program, or SNAP, provides money to low-income households to purchase food. These are also called food stamps. The Temporary Assistance for Needy Families, or TANF program, provides supplemental income to very low-income unemployed households, typically with children. To apply for these benefits, a household needs to provide evidence of their financial situation, proof of U.S. residency, and verification of each family member's age and earning situation. Another form of government transfer is a grant. A popular federal grant is the federal Pell Grant program. It provides financial aid for low-income undergraduate and certain post-baccalaureate students. It can be used toward a degree, and grant amounts depend on the student's expected family contribution, or EFC, the cost of attendance as determined by that institution, the student's enrollment status, so whether or not they're full-time or part-time, and whether the student attends for a full academic year or less. Social Security benefits are based on earnings history. So if you have sufficient earnings history, you or your dependents may qualify for the following benefits: retirement benefits when you retire, disability benefits if you become disabled, and family benefits if you were to die while you are providing for children younger than age 18. So Social Security functions primarily as a pay-as-you-go funding system. So with a pay-as-you-go program, these programs collect current taxes to pay current benefits. So let's say that currently 3 workers support one Social Security beneficiary. However, by the year 2030, this ratio will drop to about 2 workers supporting one beneficiary. Why is that? Well, that's because people are living longer and having fewer children. Thus, under the current pay-as-you-go system, the Social Security Administration may only be able to pay about 3/4 of the promised benefits. So the important thing to recognize is that future Social Security benefits will likely be different from those promised under the current law. For full benefits to be paid out in the future, policymakers will need to consider one or all of the following changes. They're either going to have to raise Social Security taxes, reduce the currently structured benefits, or reverse demographic trends by encouraging higher birth rates or increased immigration, because that way you'd have more people paying into the system.